cardiology topic we're going to look at today is cardiovascular diseases. These are a very important group of diseases in the cardiology department, and the most common conditions we see here are myocardial ischemia, angina, transient ischemic attacks, strokes, and peripheral vascular diseases. Under this topic, what we want to know is how they occur, who's at risk, how do we prevent, right? Starting with how they occur. So, cardiovascular disease is often caused by fatty deposit or plaque buildup in the arteries, which are the vessels that carry oxygen-rich blood to the entire body. What this then causes, if there is a fatty deposit buildup, is that there is narrowing of arteries, which in turn leads to restricted blood flow to the heart. And when there's restricted blood flow to the heart lacks oxygen, and then it becomes ischemic, and then we get the conditions and the symptoms we're going to speak about later on in this section of cardiology. Firstly, who is at high risk of getting this? In terms of cardiovascular diseases, we risk factors, we divide them into the modifiable and the non-modifiable ones. Modifiable cardiovascular risk factors for cardiovascular disease are based on mainly lifestyle. So people who eat high fatty foods, who are at a high risk of developing high blood pressure, people who are who consume high density lipids, who are smokers, people who drink alcohol, people who don't exercise, and obese people are at higher risk of developing these cardiovascular diseases. The non-modifiable ones are the ones that people can't control, such as age. The older you get, the higher at risk you are. Familial history. If you have a familial history, you're at high risk. Males are more susceptible than females. And in terms of ethnicity, South Asians and Sub-Saharan Africans are at higher risk than other ethnicities. In the UK, we look at the NICE guidelines for prevention, and the first thing that we want to do is primary prevention. Is for those people who haven't developed the condition, but we want to make sure they don't develop the condition. So what do? We focus on lipid modification, right? And firstly, we would say we would offer risk assessment to patients every 5 years. We say, please come in every 5 years so we can assess your risk for developing cardiovascular disease. But there's an exception to this, and the exception is for those patients who are already at high risk. And who are these people? These are people with a history of cardiovascular disease already. These are people with a history of familial hypercholesterol. These are people who are aged 85 years and older. Also, type 1 diabetes mellitus, if we remember in our physiology, the physiology behind the development of diabetes and then the consequences of it, we would know that this leads to cardiovascular disease. And so the risk assessment could return looking like 20% 10-year risk. What does this mean? This means you have a 2 in 10 chance of developing cardiovascular diseases over the next 10 years. If the risk is less than 10%, we say that the patient is low risk, but we do advise that they focus on lifestyle change so that this doesn't increase. So when do we offer lipid modification? We offer lipid modification mainly based on risk assessment outcome and the risk factors that we spoke of. So in patients who are less than 85 years old, and they have a 10% risk in 10 years, we offer lipid modification. In type 1 diabetes mellitus patients who are over 40 and who've had diabetes for more than 10 years or have also had nephropathy, we offer lipid modification. In type 2 diabetes mellitus patients who have a 10% 10-year risk of cardiovascular disease, we also offer it. And in patients who have familial hypercholesterol, we offer lipid modification. When do we consider offering it? We should consider offering it if a patient is greater than or equal to 85 years without question of their risk profile. We should also consider offering it in type 1 diabetes mellitus patients, and this is because they are at high risk already. And so what is the primary prevention method for lipid modification? We use statins, and the statin that is used in the UK is atorvastatin, and I guess in other places in the world too. And the reason why we use statins is because we want to reduce the production of cholesterol by the liver so that we don't have high cholesterol leading to fatty deposit buildup in the arteries. And we give, as a primary prevention method, we give 20 milligrams once once a day, and this should be given under specialist advice, especially if atorvastatins are contraindicated. Note that we don't use aspirins. So normally in our undergrad, we used to think of aspirins as a method of control, but we don't use them in primary prevention of cardiovascular disease. Secondary prevention, according to the NICE guidelines, this is for patients who've already had cardiovascular disease or a history of them. Here we offer atorvastatin, but in 80 milligrams, right? Note that there's contraindications. So if a patient has had a history of cardiovascular disease and we want secondary prevention, if they've had active liver disease, if their transaminases in their liver has been 3 or 4 times more than normal, if they're pregnant, if they're breastfeeding, we don't give atorvastatins. Common side effects of atorvastatins, they are not really inherently side effects of atorvastatins only. They apply to many other medications, but you need to look out for gastrointestinal problems. You need to look out for headache, myalgia, and also hyperglycemia. One thing to also remember when prescribing atorvastatins is that grapefruit and grapefruit juice, they increase the concentration of statins. So ask patients not to be taking grapefruit juice while on atorvastatins. We also want to check lipid profiles every 3 months, and once we prescribe this to patients, ideally we want to aim for a 40% drop in your non-high density lipids, in order to make sure that the atorvastatins are doing their job. And that is it for cardiovascular diseases. Here we just wanted to focus on who gets cardiovascular diseases and how to prevent them.